Welcome to the MRCS Bite session on anal canal. Today, we'll dive into this topic and explore the common questions tested during the MRCS Part B exam. For more information and full course, please visit mrcsbites.com. Embryology. The gut starts off as an endoderm tube. The ectoderm invaginates and meets the endoderm to form the anal canal. Hence, the distal half of the anal canal is ectoderm, proctoderm, derived, and the proximal half is endoderm derived. This is important in understanding the differences in characteristics of the two parts. Relations. Posteriorly, anacoccygeal body and coccyx. Laterally, ischiorectal fossa. Anterior, perineal body, both. Penis, male, vagina, female. Sphincters. The external sphincter is under voluntary control. It is divided into three parts: subcutaneous, superficial, and deep. The puborectalis sling around the anal canal, lower rectum, blends with this. This sling causes the distal rectum to join the rectum at an acute angle. This mechanism also helps to maintain continence. The internal sphincter is under autonomic control. It forms an external muscle coat at the upper end of the anal canal. Defecation. Feces arrive at the rectum from emptying of the distal large bowel, giving rise to the urge to defecate. The intra-abdominal pressure rises with increase in diaphragmatic and abdominal muscle pressures. Anal sphincters now voluntarily relax and the feces are evacuated. For more MRCS Part B resources, please visit mrcsbites.com.